we're doing compressions on an adult, we're going to push hard and fast in the center of the chest. When it comes to an infant, we want to change that up a little bit because we're concerned about their head and neck development. We don't ever want to push on the belly. We have a few more things that we need to worry about when we're talking about trying to do CPR on an infant or respond to an emergency for an infant. So from the very beginning, we still check for scene safety, but when we check for a responsiveness on infant, we don't do the same thing we do with an adult, which is like this. We don't want to do that to an infant, so instead we're going to tap and tickle their feet. Baby, are you okay? You okay? If baby doesn't respond, just like with an adult or child, we're still going to check for breathing. We're going to do that for 5, but no more than 10 seconds. 1, 2, 3, 4, 5. If baby is not breathing, then we want to make sure that we activate emergency response by calling 911 and sending someone to get an AED. Then we are going to begin CPR. Compressions look totally different for an infant. We are going to use 2 fingers right at or just below the nipple line, and we're going to compress about 1.5 inches or 1/3 the depth of the chest. Infants need special care when it comes to CPR. Here's what I want you to know for this. When we are approaching an infant to check for responsiveness, we're not going to do the same thing that we do for an adult or child, which is this. We don't want to tap and shout up here for an infant. Instead, we're going to tap and tickle at the feet. Baby, are you okay? You all right? If baby doesn't respond, we're going to check for a signs of breathing. We're going to do that for 5, but no more than 10 seconds. If baby is not breathing, we're going to make sure that we've called 911 and sent someone to get the AED. And we're going to start compressions. Compressions look totally different for an infant. Instead of 2 hands like this, we're going to use 2 fingers right at or just below the nipple line. And we're going to compress at a rate of 100 to 120 compressions per minute. Making sure we let that chest come up, back up in between. We want to compress about 1.5 inches for an infant or 1/3 the depth of the chest. And we're still going at that rate of 100 to 120 compressions per minute. Once we do 30 compressions, we're going to give 2 breaths. With adults, we talk about doing hands only. When it comes to children and infants, it's really important that we do give those breaths because they need that oxygen. So when we go to give breaths to an infant, we're going to position them in this kind of neutral airway position and put your mouth over their mouth and nose.